So today I wanted to talk a little bit about the menstrual cycle and how we think about it in Chinese medicine and some of the similarities to Western medicine and some of the differences. And I think it's really a good illustration of how Chinese medicine is very different in the way we think, but also you can see the correlations with Western medicine at different points. And so I wanted to talk a little bit about the menstrual cycle. One of the things that we do in our clinic is, if possible, we ask patients to bring in a basal body temperature chart. And it's something that we used to use a bit more in Western medicine. It's not used as often now because there's blood work that has more or less helped replace the utility of it. But in Chinese medicine, it's still useful because it can give us other clues that we are looking for that you may not be looking for in Western medicine. It's really helpful to differentiate the relative health of the yin and the yang energy and the cycling and balance of those. And so um, I wanted to go through the four stages of the menstrual cycle and just talk about what we look at in terms of basal body temperature and then the connection to the yin and the yang and the qi and the blood energy within the body. So we consider stage one to be what's called the purging stage, and it's usually about 1 to 5 days. And if a woman has not had pregnancy, we look at it in Chinese medicine as the yin and yang having peaked and now it's starting to decline, and then you have the purging or the flow that happens of the menstrual blood. Now, during this time of the flow of the purging of the bleeding, the basal body temperature is going to drop. It was going to be at around 36.2 to 36.4 degrees Celsius, and it's going to drop a bit from that high. And the having it drop down shows a good, healthy transition from a yang phase to a yin phase. So in Chinese medicine, we consider both yin and yang to be interrelated and interdependent, and they both transition from cycle to cycle and through various parts of the cycle in those phases. So you're going from a yang phase to a yin phase in the when you're having the menstrual bleed. And so having that temperature drop is evidence of the transition from yang to yin. Um, Now we go to a stage two where we have in Western medicine, we call it the follicular phase. And this is where the follicles are growing. And the follicular phase lasts from about day 6 to day 13. And in Chinese medicine, the follicular phase is thought to be where the uterus is now closed and the blood of the uterus is beginning to grow. And the follicular phase is really a yin type phase. So the yin is the nutritive, substantive energy of the body. And so during the follicular phase, the uterus lining is growing, it's thickening, it's the yin energy is enlarging within the body. And so it's really important during this time that you have sufficient blood and kidney yin and jing to help support the uterus lining. Now, if you do have a good supply of kidney, yin, jing, and blood, you're going to see the temperature be a little bit lower. It's going to be in that, like I said, from the first phase, 36.2 to 36.4 degrees Celsius range. And it's going to stay fairly steady, meaning it shouldn't be having spikes or random ups and downs. It should be a steady, low temperature. And that's indicative of good yin energy and good blood. Now, stage three after the follicular phase is ovulation. And ovulation typically happens on day 14 to 15. And you may have ovulatory mucus that happens. And when ovulation happens, that's considered the peak of the yin energy in Chinese medicine. And when you hit the peak, the yin energy is supposed to begin transforming into the yang energy. So the yang energy is generated from yin, and yin energy is also generated from yang. And so when the ovulation is happening, there will be a temperature spike. And you will notice that on your basal body temperature, and that indicates ovulation. That was one of the main reasons we used to track it more in Western medicine for that purpose, to know whether a woman was ovulating or not. So in Chinese medicine, it indicates that the yin is transforming into yang properly. And if that doesn't happen, the temperature will stay about the same. You won't have that spike. And so we want to see a nice spike, which indicates the transformation of yin to yang energy and proper ovulation. And if we see problems in any of these phases, we can then go a step deeper and figure out, okay, is there a problem? For example, if there's a problem where there's no spike happening, is the yin energy properly transforming to yang? Is there a problem with the follicular development or stasis or something else happening? And then finally, the fourth phase, the fourth stage, is the what we call in Western medicine the luteal phase. And that happens from about day 16 to day 28. And so if you have a good supply of yin energy and the yin energy reaches its fullness, it is sufficient, and then it peaks during the ovulation, and then it transforms into the yang energy, and what's happening is the uterus is preparing and getting ready to help be able to nurture a baby. And so in this phase, the basal body temperature should be a little bit higher than in the follicular phase, and it should last for about 12 to 14 days. So you should see kind of like a lower temperature during the follicular phase, and then it spikes and then stays up higher during the luteal phase. And so you should have this biphasic basal body temperature chart. And if you have a good steady rise of the temperature throughout that day 16 to day 28 luteal phase, that's a good indicator that the yang energy is plentiful and that you're not having a yang problem in your menstrual cycle. So that's just a quick overview of the 4 stages of the menstrual cycle and how we use changes in the body temperature to help diagnose whether you are having a yin problem or a yang problem or a transformation problem. And then we can further subdivide it into subtypes. And so anyways, I hope that's useful. And if you'd like more information, visit us at www.houstonacupuncture.com, and we'll see you next time.